Tale of Two Hygienists presents this week's TIPisode. Quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode. This week brought to you by GC America.
Hello from Missoula, Montana. I'm Susan Wingrove, and I'd like to share a new application for MIPASTE and MIPASTE Plus. A special thank you to GC America for their research and development of MIPASTE to buffer the pH level in the oral cavity. As hygienists, we need to look at oral plaque and pH differently. Biofilm is dental plaque in the oral cavity, and now the research indicates that we need to focus on the whole patient, not just the oral cavity. Consider adopting the biofilm term for dental plaque and look at oral biofilm differently as a focus for our prophylaxis, not just to remove calculus that's present. MIPASTE and MIPASTE Plus contains recaldent. That binds to oral biofilm, soft tissue, and dentin, providing a reservoir of bioavailability, calcium and phosphates in the saliva and at the tooth surface to protect. The science behind MIPASTE speaks for itself as truly amazing. The active ingredient in MIPASTE is a milk-derived protein and should not be used by patients with milk protein allergies. Let's shift our prophylaxis appointment into a new gear. Eliminate biofilm and remove the calculus with equal focus. To move into biofilm focused care, the hygienist needs to start testing the patient's saliva for pH, identifying and removing the oral biofilm, applying fluoride and or antimicrobial varnish each time, educate the patients on pH and biofilm and the link to oral systemic health. For biofilm-focused care, the objective is to bring the patient's oral cavity into a balanced neutral pH. How does a patient present for their prophylaxis appointment? Have they just eaten? Have they drank a soda drink or sipped on a coffee? As a true Norwegian, I often have coffee, and I would walk into the operatory and place my to-go cup on the counter, get into the chair for my prophylaxis appointment. My pH would automatically be in a low level due to the coffee. So who do you test for this? It's important to get a baseline pH on any new patients coming into your practice. Any recare patients, especially recare patients with unexplained caries, high-risk caries patients, or diagnostic periodontal disease patients. Current patients prior to orthodontics, implants, or restorative treatments. Patients with serious medical treatments use MIPASTE prior to radiation and chemotherapy 2 to 3 times daily. If the oral cavity is in a neutral pH, they are less likely to get the mouth sores that are prevalent in radiation or chemotherapy. So I'd like to introduce you to another application for MIPASTE and MIPASTE Plus to use as an integral part of biofilm focused care prophylaxis protocol. That includes testing the patient's saliva for pH. A healthy saliva will be at a 6.8 to 7.8 level. Identifying the oral biofilm to remove, and note any acidic areas of 4.5 pH or lower with products like GC Tri-Plaque Gel. Remove the oral biofilm by polishing first or using a subgingival air polisher with erythritol or glycine powder. Next, add your MIPASTE or MIPASTE Plus to buffer the patient's pH level in the oral cavity and obtain a neutral pH oral cavity for the time of their appointment. In a study that was completed, they had MIPASTE and MIPASTE were used as directed and applied to all the teeth, and the pH was measured then after 30 minutes, 60 minutes, 24 hours, 36 hours, 48 hours, and 96 hours. After you applied the MIPASTE, which works within 3 minutes to neutralize the pH in the mouth, how long does that last? Well, for MIPASTE, according to this study, it lasted for 48 hours. MIPase Plus lasted for 96 hours. Of course, this will change due to diet and other things that are happening with your own medical history. So patients should apply MIPase or MIPase Plus twice daily is recommended. Patients or clinicians would then apply the MIPase in the mouth while the patient is in the chair. The patient can spit out the excess in a cup or the clinician can suction. Do not rinse. Take any necessary radiographs and assessments with an intraoral camera. Then complete your prophylaxis debridement and polish any stains on any restoration. Now with the neutral pH oral cavity, apply your fluoride or your antimicrobial varnish or your desensitizing treatment. Studies show that these bioactive, innovative products will work to their optimal level if the patient is in an oral pH balance when they're applied. So have the patient not eat or drink for 1 hour following the appointment or follow the varnish or desensitizing treatments directions for use. Set your recare at least every 6 months for patients with any restorations or implants. Send the patient home with MIPase or MIPase Plus to use at home twice daily. Ideally, the patients would use it after breakfast and not eat and drink for a half hour or the last thing before bed. Biofilm focused care, prophylaxis protocols, and innovative products like MIPase and MIPase Plus can be used to eliminate inflammation that lead to the bone loss in natural teeth and around implants. It's a vital time to protect our patients' teeth with these type of products and around implants, restorations, and most importantly, for your overall health. Thank you.
Thanks for listening to another TIPisode, and thank you to GC America for sponsoring this week's episode. You can find out more about their great products at gcamerica.com. And don't forget to hit the subscribe button in your podcast app. Follow us on Facebook or Instagram, and head over to our website, ataleoftwohygienists.com, to sign up for our newsletter. And we always appreciate ratings and reviews. Thanks again for listening to your unofficial dental hygiene podcast.